Make sure to watch this video till the end and you will learn how to treat a runny nose completely for free and how to use nasal sprays and drops the right way. I'm sure you've never done it this way before. Every year, Americans spend over $14.5 billion on nasal sprays. A runny nose is one of the most common health issues, and most of us deal with it several times a year. But in many cases, self-treatment with over-the-counter nasal sprays and drops actually makes things worse. It doesn't make you healthier, it just drains your wallet. So first of all, where does all that mucus even come from? Your nose isn't that big, right? Well, in reality, what we call the nose hides a complex system of labyrinths, tunnels, and passages. All of that is lined with a mucous membrane that constantly produces mucus. This large surface inside your nasal cavity exists for a reason. It warms up the air you breathe, adds moisture to it, and traps bacteria, viruses, and dust particles so they don't reach deeper into your body and cause infections. And there's another cool function. Your sinuses help you speak louder and make your voice sound better when you sing. I'm not a great singer, I know. When you catch a cold or get a viral infection like the flu, viruses invade the cells of your nasal lining. The nose is the body's first filter that tries to stop the infection right at the entrance. When that happens, the mucous membrane starts to heat up. Its temperature rises, and you feel such a burning sensation inside your nose. You might blame your poor suffering nose and think it's the problem, but in fact, it's doing its best to neutralize the virus, and it's actually pretty good at it. When the temperature of the mucous membrane reaches around 37 degrees, the cells slow down the virus' ability to replicate. That means the virus can't multiply as fast or spread further into your body. At the same time, the production of mucus increases, and that's when your nose starts to run with clear, watery snot. Your nose is just trying to wash away all the viruses. This is the very beginning of the simply common cold. If the mucosa can't handle the infection on its own, things start to escalate. Mucus production increases, and the mucus becomes thicker because it now contains not just viral particles, but also immune cells, and maybe even the bacteria that naturally live in your nose begin to multiply actively. At this stage, your snot turns yellow and becomes denser. Normally, the tiny cilia, the microscopic hair-like structures on your nasal cells, move mucus out of the nose. But when the mucus gets too thick, it immobilizes those cilia. As a result, mucus gets trapped inside your sinuses. When it can't drain properly, bacteria begin to grow rapidly. The snot turns green and often develops an unpleasant smell. It usually means you have a bacterial infection now. When your nose feels stuffy, that's actually your body's way of raising the temperature inside your nasal passages. When air stops flowing freely through the nose, it no longer cools the mucous membrane, which allows the temperature to stay higher and helps the body fight off the virus more effectively. So, that's on purpose. In simple terms, the main problem with any cold or congestion is this. The mucus that used to move is no longer moving. So our main goal is to get that mucus flowing again. I'll explain exactly how to do that in a moment. But don't forget to subscribe and hit the bell so you don't miss future videos about your body and health. The most important part of treating a runny nose is maintaining good nasal hygiene. With proper cleansing of your nasal cavity, you can quickly get rid of congestion, prevent complications, and best of all, do it completely free. The first thing you should do at the very first signs of a runny nose is rinse your nasal passages with saline solution. As I mentioned earlier, our goal is to make the mucus thinner and more fluid, so it can clear out of the nasal cavities and give the mucous membrane a chance to heal properly. It's very important that any drops, sprays, or solutions you use in your nose are brought to body temperature before applying them. You can simply hold the bottle under your arm or a couple of minutes to warm it up slightly. This helps the solution work better and move more easily through the nasal passages. Just don't boil it or place it in a very hot water. It should be body temperature, not hot. So let's talk about the saline rinse. You can buy saline solution, it's a sodium chloride 0.9, at any pharmacy. This type of saline is called an isotonic solution, which means its salt concentration is the same as that of our blood, 0.9% of sodium chloride. The big advantage of an isotonic saline is that it doesn't change the size of the cells in your nasal lining. It doesn't make them shrink or swell. Instead, it gently moisturizes the mucous membrane, thins the mucus, and helps it drain more easily from your sinuses so it doesn't stagnate and cause further inflammation. There is a simple trick for when your nose is completely stuffy and any drops just keep coming back out. Just do like that. Inhale, hold your breath, pinch your nose, and turn your head from side to side like this. You can repeat this several times while holding your breath. The congestion will clear up briefly, and you can use drops or saline solution. It's important to rinse your nose with saline, not just use it like regular nasal drops. This means not 2 or 3 drops per nostril, but a proper rinse with a fairly large amount of solution, at least 30-40 milliliters. As I mentioned before, you can also make your own saline at home, completely free. To do this, just dissolve 1 teaspoon of salt in 1 liter of freshly boiled water. If you can find non-iodized salt, that's better, because iodine can sometimes irritate the nasal lining. Make sure the salt is fully dissolved. No crystals left at the bottom of your bottle or cup. Undissolved crystals can burn the mucosa and make things even worse. Before use, cool the solution to body temperature and store it in a clean bottle with a lid in the fridge for no more than 24 hours. Don't forget to heat it up before using. To relieve nasal congestion, you can use a hypertonic saline, meaning it's saltier than your blood plasma, with a concentration of about 3 to 5% of sodium chloride. You can buy it also in a pharmacy or make it at home. Just dissolve 3 spoons of salt in 1 liter of water. You shouldn't overuse this solution because it can dry out the nasal mucosa, but thanks to its higher salt content, it draws excess fluid out of the tissue, which helps reduce swelling and congestion. So it may help. The best way is to rinse your nose twice a day with an isotonic, just a normal saline solution, and once a day with a hypertonic solution, the saltier. Never rinse your nose with plain water. First, it can cause swelling because the water moves into the mucosal cells. Basically, your nasal lining would swell, which leads to irritation and congestion. Another great option for rinsing is using a special nasal irrigation pot, also known as a neti pot. This technique is ancient. It comes from traditional Indian medicine, but today ENT doctors all over the world recommend it because it really works. You can find a neti pot in most pharmacies, often with a pre-measured sachet of salt included, or you can buy one online. To use it, fill the pot with a warm saline solution, place the spout against one nostril, lean your head forward and tilt it slightly to the side. The liquid will flow through your nasal cavity and out the other nostril. washing away excess mucus. Then gently blow your nose and repeat the same process on the other side. This neti pot is especially helpful for people who often suffer from nasopharyngitis or pharyngitis. In these conditions, the upper part of the nasopharynx is inflamed, and it's very difficult for sprays or nasal drops to reach that area. If while rinsing your nose you gently pull the saline back toward your throat and then spit it out through your mouth, you'll be able to flush that hard to reach upper section as well. The only real side effect of using a neti pot is the risk of developing an ear infection. That's because the eustachian tube, which connects the nasopharynx to the middle ear, opens right into that area. During rinsing, liquid can sometimes enter this canal and reach the middle ear, carrying bacteria along with it, and that's how an ear infection can start. If you are prone to ear infections, it's better to stick with gentle saline drops rather than full nasal irrigation. For children, using a neti pot also isn't the best idea because their eustachian tubes are shorter and wider, which means the risk of infection spreading is much higher. One big advantage of such an irrigation is that there is no pressure on the nasal mucosa. Many modern saline sprays or so-called nasal showers push the liquid under high pressure, as if trying to blast through the congestion. But in reality, that kind of force is harmful to the mucosa. The pressure damages the delicate cells, and it's better to avoid such aggressive methods. When you are sick, treat your body with patience and care. For most cases of a runny or stuffy nose, this gentle rinsing are more than enough. However, if your situation is more complicated and you decide to use some additional treatments, don't worry, we'll talk about those too. The most common remedies for a runny or stuffy nose are unfortunately vasoconstrictor medications, also known as decongestants. The most common ones you can see here right now. They are among the most widely used nasal drops or sprays. They really do provide quick relief by constriction of the blood vessels in the nasal mucosa. As a result, blood flow decreases, excess fluid leaves the tissues, and you begin to breathe more easily. But your stuffy nose isn't just an annoying symptom, as I said. It's a mechanism for killing viruses by high temperature. So by these drops, you are disrupting this mechanism and becoming easy prey for viruses. It will simply ease your discomfort, yes, but it will not cure you. The main problem with these medications is that they can cause addiction very quickly. The duration of use should not exceed 2-3 days. And if you are prone to allergies, that period may be even shorter. After that, the medication becomes just less effective, and there is a risk of developing rhinitis medicamentosa. That means nasal congestion and a runny nose caused by overuse of the sprays themselves. A frustrating paradox, but a common one. Saline solution does not have this side effect. It's important to maintain balance. You shouldn't be afraid of these medications, but also shouldn't use them frequently or continuously. If you do decide to use a decongestant, or if your doctor prescribes one, remember that nasal hygiene is still essential. The best approach is to apply the decongestant first to open up the nasal passages, and once you can breathe through your nose, rinse it with a saline solution. Decongestants don't kill bacteria or viruses and don't improve the condition of the mucosa. They only relieve your discomfort. That's all. If your snot has already turned green and your doctor has prescribed an antibiotic spray, remember, it's useless to apply it when your nose is clogged with mucus. The medication simply won't reach the affected cells through this thick layer of mucus. Here's the correct sequence, what you should do. First of all, use the decongestant if you have a stuffy nose. This opens the nasal passages. After that, rinse with saline to remove excess mucus. And only after that, apply the antibiotic spray or drops. If you don't have time for a full rinse, at least make sure to use the decongestant if your nose is stuffed before the antibiotic. Never the other way around. If you start experiencing additional symptoms such as bronchitis, sinusitis, or other infections, and your doctor prescribes systemic antibiotics in pills, don't forget about nasal rinsing. The reality is that oral antibiotics don't work very effectively inside the nasal cavities, especially in these sinuses, where pus can easily accumulate. You need to flush it out even while you are taking systemic antibiotics. Otherwise, here's what often happens. You take antibiotics for 5 days, for example, start to feel better, the symptoms seem to disappear, but a week later, it all comes back. That's because a small amount of pus and bacteria remained trapped in your sinuses and triggered the infection again. The problem lies in the very narrow bone canal connecting these sinuses to the nasal passages, where mucus is supposed to drain. In the lower part of that cavity, pus can easily collect. Even under normal conditions, when your mucosa isn't inflamed, this canal is already quite narrow. But when inflammation and mucus buildup occur, the passage practically closes off. This makes it very difficult to clear out the contents of those sinuses, especially this lower area. When you apply any medication, whether it's saline or a prescribed drug, it's crucial that it actually reaches the mucosal surface. Most people simply tilt their head back and squeeze in a few drops, but in that position, the liquid just flows along the lower nasal passage and drips into the nasopharynx, where you swallow it. That's all. As a result, the medicine only reaches a tiny portion of your nasal mucosa, leaving most of the area untreated. Our goal is to make sure the drops come into contact with as much of the nasal lining as possible. These frontal sinuses are located in front of the throat, and to effectively rinse them, the solution needs to flow into that area. There are several head positions and techniques that can help you achieve this. That's not so difficult. First method, lie down on your bed or couch and let your head hang down while lying on your back. Your position should be such that your nose points not straight at the ceiling, but at the corner where the wall meets the ceiling. In this position, the medicine you apply will also reach the frontal sinuses. Put in the drops and stay in this position for a while. After this, repeat the same with the other nostril. Second method. Similar idea, but this time lie on your stomach with your head hanging down. After applying the drops, slowly turn your head from side to side so that the medication spreads evenly over the nasal mucosa. Third position. It looks a little unusual, but it's effective. Kneel down, bend your head forward, and apply the drops. Again, turn your head gently from side to side afterward to help distribute the solution. And the last option, a bit simpler. Lie down on your bed, tilt your head back, and turn it about 45 degrees toward one shoulder. Then apply the drops into the lower nostril. Afterward, gently press the nostril with your finger and take a few light breaths in. Don't force it. If air isn't passing through easily, don't push it. Otherwise, you might damage the tiny blood vessels in your nasal lining and the swelling will only get worse. And if in the end you are applying the drops the usual way, Just make sure that afterwards you sit up, lean forward slightly, and turn your head from side to side very slowly, so at least some of the medication reaches the frontal sinuses too. Let me know in the comments, does anyone actually do it this way? And share this video with your family and friends. I bet most of them have no idea how you're actually supposed to apply nasal drops correctly. Now let's talk about nasal sprays. When you use a spray, make sure the nozzle isn't pointing straight up your nasal passage. Instead, aim it slightly outward, toward the outer corner of your eye. Also, don't press the nozzle tightly against your nostril. The spray needs room to flow out. This helps the medicine distribute evenly inside your nose. If you spray it straight into the central nasal passage, it will only cover that narrow area and won't reach the rest of the nasal cavity. After spraying, take a few gentle breaths in to help the medicine spread across the mucous membrane. And remember, always disinfect the nozzles of your sprays and the droppers of any nasal solution anyway. Otherwise, they can become a breeding ground for bacteria. Not every nasal solution or nasal product has antibacterial properties, so hygiene really matters. If you are using a neti pot, make sure to wash it thoroughly with soap after each use. When you blow your nose, wash your hands with soap afterward. Bacteria remain on your skin, and in general, during any illness, wash your hands as often as possible. There is no need for antibacterial soap that kills 99% of germs. Regular soap does the job perfectly well. Instead of cloth handkerchiefs, oh my god, who came up with this word? Handkerchief? Such a difficult word for such an easy thing. Use disposable tissues. A fabric handkerchief is basically a pocket full of bacteria. But don't let used tissues pile up on your nightstand or in your trash can either. Throw them away frequently. Also, make sure to air out the room often, especially if someone in your house is sick. Fresh air reduces the concentration of bacteria and viruses indoors. If you are worried about drafts, just open all the windows, step out for a few minutes and close them when you come back. If this video helped you understand your body a little better, if you learned something new or useful, subscribe to the channel. Here I talk about how your body works and how to keep it healthy and happy. Remember, your nose is your body's first line of defense against infections, dust, and allergens. Take care of it, treat it gently, and don't forget about nasal hygiene, especially when you are sick. Stay healthy and see you in the next videos.